invite Marcin to take our role among us. I'm Charlie Klippel, and Marcin, I'll let you go from there.
Thank you, Mr. Chair. I just want to remind everybody that CTN is covering this meeting as well. We are recording this meeting for the minute-taking purposes. Paul Philpott.
Here.
CC Woods. Thomas McNeil. Mr. McNeil, I believe you're
Present.
here. Thank you. Graham Rader. Victoria Veltri. Stephen Hernandez. Matthew Brockman. Commissioner Deidre Gifford from DSS.
Present.
Thank you.
And can I just let you know that I have 2 invitations for this meeting. One is labeled executive session at 9 a.m. I joined that and I was the only one in the room there, and there's somebody else also waiting to join that meeting. So just FYI.
Okay, the executive session, thank you, Commissioner Gifford. The executive session will take place closer to the end of the meeting.
Okay.
Okay, thank you. Gregory Messner from OPM.
Present.
Peter Doolittle from OHA. Yvonne Adolf.
Present.
Dimas. Okay.
Good morning, present.
Good morning. Paul Lombardo from SID.
Here.
And Heather Aaron from DPH. Thank you. Thank you. And I believe Ms. Woods is just joining us. So yes, we do have a quorum. Thank you, Mr. Chair.
Thanks so much, and apologies for the slight confusion on the invitations. We do have an executive session, or I'm going to ask us to vote in an executive session here in a moment. But before that, could I ask the executive team of Active Health to who are on the call to introduce themselves?
Good morning, all. James Michel, the CEO of Access Health Connecticut.
Good morning, Tony Crow, Chief Operating Officer of Access Health Connecticut.
Good morning, Daryl Jones, Finance Director, Access Health Connecticut.
Good morning, everybody. Robert Blundo, Director of Technical Operations and Analytics.
Good morning.
Good morning.
Sorry.
Caroline Lee here. Go ahead, John.
Sorry, Caroline. Go ahead, please.
No worries. Hi there. Caroline Lee, Director of Marketing.
Good morning, everybody. Director of Shop and Product Development.
Anyone else?
Good morning.
have one more.
Tammy Hendricks, Director of Health Equity and Outreach.
Welcome.
Mr.
All right.
Chair, there's no public comment.
Yes, I was going to ask. So we have no public comments?
No public comment.
All right, then our next order of business is to approve the agenda, or sorry, the minutes from the last meeting. If there are any comments to those minutes, please let me know.
So moved, CC Woods.
Thank you, Cece.
Seconded, Tom McNeil.
Thank you, Tom. We'll take a roll vote. Charlie Klippel, yes.
Thank you. Paul Philpott.
Yes.
Gregory Messner.
Yes.
Deidre Gifford.
Yes.
Graham Rader.
Yes.
Stephen Hernandez.
Yes.
Peter Doolittle.
Aye.
Thank you. CC Woods.
Yes.
Thomas McNeil.
Yes.
Victoria Veltri. Matthew Brockman. Thank you.
Thank you. Appreciate that. I'm going to ask for another vote now, and it's an amendment to the agenda because I'd like to have an executive session later in this meeting, purpose of which is to discuss the performance and of the CEO. So we would move to an executive session for that purpose and then return to the meeting itself. So I would request your approval to make that agenda edit to allow for an executive session in this meeting. And again, Charlie Klippel, yes.
Mr. Chair, I believe you have to make a statement about the statute number that.
Oh, my apologies. So this is exempt from disclosure pursuant to section 1-200, subsection 6, subsection A, for the evaluation of a public officer or employee.
Thank you, Mr. Chair. Is there a motion?
So moved by Ted Doolittle. Seconded by Tom McNeil.
Okay. A roll call. Charles Klippel,
Yes.
Paul Philpott,
Yes.
Gregory Messner,
Yes.
Dietrich Gifford,
Yes.
Brian Rader,
Yes.
Siva Hernandez,
Yes.
Peter Doolittle,
Aye.
CC Woods,
Yes.
Thomas McNeil,
Yes.
and Matthew Brackman. Because Ms. Veltri is not present today. Thank you.
Okay, Martin, when the time comes, you're going to have to talk us through the mechanics of that meeting, but I'll leave that to you. Next item is, please, James, a CEO update for us. Thank you.
Thank you, Mr. Chairman. Good morning, all. Again, I'm James Michelle, the CEO of Access Health Connecticut. Welcome to our September board meeting. Before we move into our planned presentation, we recognize there are some who are not able to join us today because today is a holy day. This is the holy day of Yom Kippur. We wish those observing the holiday an easy fast. As a reminder, please note this is a public meeting and there's a separate number for the public. I hope everyone enjoyed the summer. It's great to see you all back once again. Now that Labor Day is behind us, at Access Health Connecticut, it means we are headed into what is typically the busiest time of the year for us. As I mentioned, as I made the board aware earlier in the week, Access Health Connecticut was awarded a $1.1 million grant from CMS to help to defray the cost of implementing the American Rescue Plan, as well as some other IT security projects. We are very grateful for that award, and we appreciate the board's support when we're implementing the American Rescue Plan needs. We have a lot to cover today. However, I'd like to remind you about the upcoming board training scheduled for Wednesday, October 13th at the Connecticut Historical Society, and also about our return to the office that started this past Monday. As of this Monday, we begin to implement our plan. For the first month, half of our team will work from the office on Mondays, and the other half will work in the office on Wednesdays. After a month, each cohort will return to the office for 2 days a week, and no one will work in the office on Fridays. We will also be continuing to a strict protocol to ensure safety, including mask wearing at all times, limited capacity in conference rooms, cleaning products throughout the office, which must be used before and after using shared spaces, and social distancing. Today's agenda will begin with a 2022 rate review presentation by Paul Lombardo from the Connecticut Insurance Department. Paul, I want to, on behalf of the board and my team, I want to say thank you for joining us today, and we look forward to hearing from you. After the rate review, there will be a brief presentation from the chair of the strategy committee, Stephen Hernandez, and myself. It's been nearly a decade since our guiding principle framework was adopted by the board. For the board's recommendation, we are considering changes to our mission and vision, principles, and potentially making changes to our advisory committees as well. In addition to revisiting elements of our guiding framework, we are also working on several strategic initiatives, including the formation of a subsidiary, a broker academy, which you will hear more shortly, which is a new way to help address health disparities within Connecticut communities where there are high populations of uninsured. Updates to our IT infrastructure, a financial strategy to identify additional revenue streams that would support our strategic initiatives, and an increased effort to reduce health disparities under the guidance of new senior leadership. While we are still developing our approach, we will come back to the board for the board's input. While November 1 first may seem a ways away from us, there's much to be done in preparation for open enrollment. Today's agenda also includes an open enrollment readiness update that will be presented by Robert Blondo, Director of Technical Operations and Analytics, as well as Caroline Lee, Director of Marketing. Caroline will then be joined by Tammy Hendricks, Director of Health Equity and Outreach, for an update on marketing and our outreach strategy for the upcoming open enrollment. Both Caroline and Tammy are new to Access Health Connecticut, and I'd like to take a moment to formally introduce them. Caroline started in June as a Director of Marketing. She comes to us from the Travels and previously supported Access Health Connecticut public relations during her time at Menton Hoke. Tammy started in August as a Director of Health Equity and Outreach, a new distinct department at Access Health Connecticut. Tammy has extensive marketing and outreach experience in this space. With Health Equity and Outreach as its standalone department, Access Health Connecticut is better positioned to address our mission-driven goal of reducing health disparities. Please join me in welcoming both Caroline and Tammy to the organization. Caroline, then after that, Caroline will provide an update on our efforts to market the extended special enrollment period in the new Covered Connecticut program. And Tammy will share our progress on several outreach plans, including the 2021 Community Conference and our open enrollment outreach strategy. As part of our commitment to reducing health disparities, we recently launched a health disparities web page. Following the marketing and outreach update, Rob Blondo will walk us through this new online resource for the public and elected officials. Susan Richby, Director of Legal and Government Affairs, is out today. I'd like to provide an update on federal changes we are watching very closely. As you may have heard, the federal government is considering a new date to conclude the annual open enrollment period moving forward. The new date proposed is January 15th, replacing December 15th deadline from previous years. In addition, Congress is also working on a legislation package. It's known as the Build Back Better Act, pursuant to the $3.5 trillion budget resolution passed in late August. The proposed investment in healthcare would include the following: making the American Rescue Plan Act changes to premium tax credits permanent, and extending the enhanced subsidies for those receiving unemployment through 2025. The legislation also proposes changes to fill the Medicaid and coverage gap in non-expansion states, and to enhance Medicare benefits to include vision, hearing, and dental benefits. The impact of these proposals will be significant, as the Commonwealth Fund and the Urban Institute estimate that making the premium tax credit expansion permanent and filling the Medicaid coverage gap alone would reduce the number of uninsured people by 7 million by 2022. We anticipate updates on both matters very soon. Once we know more, we will share that information with you. And lastly, I'd like to share our future agenda items. Next month, Weekly Consulting Services will present the Consumer Impact Study for the planned year 2022. And we will provide updates on the following. Potential changes to our operating policies pursuant to the last state audit. Open enrollment updates, our strategic initiatives, including Subsidiary and Broker Academy, several audits that are ongoing, and review of our mission and vision in the current advisory committee structure. Thank you all for listening to me this morning. At this time, I will pause for any questions. Thank you.
Thank you, James. Very thorough. Appreciate it. And Paul Lombardo, I believe, next on our agenda. Paul, thank you so much for joining us this morning.
Thank you. Hello, everyone. Good morning. I hope everyone is well. On Friday, September 10th, the insurance department made final rate decisions for all individual and small group ACA plans for the 2022 benefit year. Our scope of review was 11 companies, 15 rate filings, for the individual and small group market, and approximately 222,700 covered lives combined in the individual and small group market. Items contributing to the 2022 rate increases. It may sound like I'm a broken record, but these are the things that impact our health insurance rates on an annual basis. Annual trend, which is the most significant. There are two pieces to annual trend. There's the medical inflation that is hospital inpatient, hospital outpatient, and then what we call professional, which are your physicians, both general and specialists. This is the factor that accounts for rising healthcare costs. The other piece of this is prescription drugs. There is a unit cost piece to trend, and there is a utilization piece to trend as well. On average, the overall impact for medical trend in Connecticut that was filed by the carriers was 8.8% for 2022. There's also an experience adjustment that accounts for worse than expected or better than expected experience in 2020 and needs to be recalibrated to the approved base rate for 2020 before they project it forward using annual trend. One item I would like to talk about before I get into this slide is 2020 experience was the base experience period. It's required to be the base experience period from the ACA. You have to take that experience and project it forward. It's the last complete year of experience, and that's how the ACA is structured. It's required to. So we obviously had a significant interruption due to the pandemic in 2022, especially in March, April, and May, when the pandemic first hit. There was a significant drop in utilization of many services. Elective procedures were down significantly. The use of the emergency department was down significantly. So when you're trying to project into 2022, while we are still in the middle of the pandemic, we have a vaccine. Utilization of services has increased dramatically from those 3 months in 2020. So 2020 experience has to be recalibrated and normalized to what we would normally expect 2020 experience to be before it's projected into 2022. That impacts the pricing and the projections for what we analyzed. Specifically, COVID-19, building in a 0.5% increase in the rates for 2022 is primarily due to the vaccinations, ongoing vaccinations, future boosters, and continued testing for COVID-19. The normalization of 2020 experience has already been described, and deteriorating morbidity. There's two pieces to this. One, the small group market continues to shrink in Connecticut. There could be a myriad of reasons why it continues to shrink. We lost a significant number of small employers in 2020 due to the pandemic. We could have had small employers move out of state. We could have had small employers that became large employers. Small employer definition in Connecticut is 2 employees up to 50. So as soon as they breach 50 and they get to 51, they're considered a large employer in Connecticut for rating purposes. The other aspect of the deteriorating morbidity is, as I stated before, there was a delay in services, a significant delay in services in 2020. Not only elective surgeries, but people going for their preventive care. Annual physicals, annual testing for a myriad of things. was delayed significantly. As a result, we have seen some morbidity deterioration or health deterioration as a result of that. And we've seen it in the first 5 months of 2021. It's been a significant increase, not only to utilization, but the severity of services that were provided that are above the normal level of services provided in the first 5 months of 2021. Next slide, please. Before I get into the detailed requests and changes, the average rate increase for 2022 in the individual market was 8.6%. The department approved an average increase of 5.6%. In the small group market, the average requested rate increase was 12.9%, and the department approved an average increase of 6.7%. I'll go through the individual company filings. This is on exchange individual. Anthem Health Plans requested an average increase of 12.3. The department approved an average increase of 5.8. The asterisk for Anthem Health Plans is Anthem Health Plans both participates on and off the exchange. So the covered lives of 28,071 is a combined total for Anthem, both on and off. Connecticut Benefits Inc. requested a 7.4% average increase. The department approved an average increase of 5.5. Connecticut Benefits Inc. only operates on the exchange. Obviously, if someone from off the exchange inquired about Connecticut Benefits Inc., they would have to sell them an individual policy off the exchange. But Connecticut Benefits Inc. or CBI is not required to market off the exchange or actively market off the exchange. They have the lion's share of Access Health CT individuals at close to 82,000. We have a new entrant onto the exchange for 2022. It is a Connecticut company, but it is Connecticut Insurance Inc. It's their indemnity company. Connecticut Insurance Company Inc. currently participates in the individual market off exchange. But beginning 1/1/2022, they will be offering both on and off the exchange. Next slide, please. For the shop or on exchange for small group, Anthem Health Plans requested an 11.5% increase. The department approved an average increase of 2.9. Again, Anthem participates both on and off the exchange. In the small group market, the bulk of the 25,000+ members or covered lives is off exchange. CBI requested an increase of 13.6 on average, and we approved 10.3. CBI only operates on the exchange in the small group market, and their total covered lives was close to 1,800. Next slide, please. Off exchange in the individual market, as I mentioned, Anthem participates both on and off. Connecticut Inc., which is Connecticut's HMO, requested an average increase of 10.9. The department approved an average of 8.6, and they have approximately 3,000 covered lives. And Connecticut Insurance Company, which I just mentioned, is currently off exchange. They requested an average increase of 5.1 and an average increase of 3% was approved. They have a total of close to 3,100 off exchange, but again, 1/1/2022, they will be participating both on and off the exchange. The next slide, please. This is the remainder of our small group market, which is off exchange. Aetna Life Insurance Company originally filed for a 14.1% increase. They have one plan in the market. We disapproved the filing in total. It covers approximately 150 people. The major reason for the disapproval was Aetna Life Insurance Company received a significant risk adjustment payment for their cohort. that wiped out any need for a rate increase for 2022. We had a new entrant in the small group market effective 7/1/2022, and that's Cigna Health and Life Insurance Company. They will be an active participant in the small group market off exchange for the entire 2022 benefit year. Connecticut Inc., again, which is Connecticut's HMO, requested an average of 11.6. We approved 7.5. Connecticut Insurance Company in the small group market requested an average of 7.4. We approved 3.5. They have about 18,000 covered lives in the small group market off exchange. There's two Harvard Pilgrim companies, Harvard Pilgrim Healthcare Inc., which is an HMO, requested an average of 14.5. We approved 8.4%. And Harvard Pilgrim Healthcare Insurance Company Inc., which is their indemnity carrier, requested an average of 13.1, and we approved 7.1. Those two companies combined cover approximately 9,000 lives in the small group market. And lastly, three United companies, United Healthcare, Oxford Health Plans, and Oxford Health Insurance. Oxford Health Plans is the HMO. They requested an average increase of 15.6. We approved 9.9. Oxford Health Insurance, Inc., which requested 15.8. We approved 10.1 and has the lion's share of covered lives in the small group market in Connecticut off exchange at 47,000. And finally, United Healthcare Insurance Company requested an average increase of 14.3, and we approved 8.7%. That concludes my review of 2022 rate actions approved by the insurance department, and I'd be more than willing to take any questions at this point.
Any questions from the board? Ted? Ted Doolittle?
Yes, somebody, was Paul about to say something in addition?
Go ahead, Ted.
Okay. Thank you so much, Mr. Chairman, and I do want to extend my thanks to Paul Lombardo and his team at the insurance department for such a thorough review. I will mention, as I always do, the Office of the Healthcare Advocate, which I head, is always grateful to Connecticut and Anthem for their participation on the exchange. And certainly also recognize that Connecticut's rate requests were a little bit below their competition, and that was much appreciated. I will just mention that in terms of the utilization we're seeing so far this year, obviously Connecticut can certainly be different, but Epic Health Research Network recently put forth a study by Cynthia Cox and others stating that healthcare utilization and spending remain below expected levels in early 2021. So I hope that's a national figure, I know, but it certainly is the case that we do need to keep an eye on whether, in fact, there is a rebound going on in Connecticut. I also want to thank some of the groups such as Universal Health Foundation, Connecticut Citizens Action Group, and the Connect faith organizations from New Haven on down to Fairfield County for their activity during this rate hearing process. Thank you, Mr. Chairman, for allowing me a moment to make those comments.
Thank you. Paul, I'm sorry.
Yes. So I'd like to echo Ted's comments about the support we get in the insurance department, and specifically Paul. They've always done a great job for us, and they're great partners. So Paul, thank you very much. I really only have a couple quick things. One, if I heard you correctly, Connecticut Indemnity Company is a new entrant. Is that correct?
On the exchange in the individual market, that is correct, Paul.
Okay, so if I'm a shopper looking for a QHP, what benefit is there to me that Connecticut has a separate platform that's now offering that now has an offering?
It's a separate legal entity, so the risk is kept separately, and the experience is kept separately. So even though it has the Connecticut name on it and it's affiliated with Connecticut, Paul, they are separate companies. And so it's like anything else. You have another offering. It could be company XYZ. It doesn't necessarily mean that just because it has a Connecticut name to it. Again, the experience is kept separately. The risk adjustments are kept separately. Everything is kept separately. The finances. So it's just another option for people with different plan designs and different rate structure.
So what, if anything, is the difference in the underlying cost structure of those two entities?
It's their experience. Their base experience is separate and distinct. So, you know, one you have 81,000 lives and the other one you have much less lives. So it's the experience differential between the two.
But I guess what I'm getting at is the unit cost for both entities is going to be the same, the network, right?
It doesn't necessarily have to be, Paul.
Okay. All right. As far as the small group cohort, small group 2 to 50, how many lives do we have left in that now?
I think it's under 110,000.
Okay. All right.
And it's declined every year for the last 3 or 4 years.
Yeah. And we talk about this every year, don't we, Paul? Because you know, the exchanges financing comes as a result of that. So anyway, thank you. Appreciate it.
Yeah.
Well, thank you. I appreciate the comments, and I think I would speak for James when I say the exchange is going to be watching the impact of having two Connecticut plans on the on the exchange. It's a new dynamic, so we'll see how it plays out. Thank you.
Yeah, Charlie, I just want to add one last comment that is unique as a result of the ARPA subsidies. ARPA subsidies have increased the subsidies significantly to people already receiving subsidies on the exchange. Mm-hmm. And it's also afforded subsidies for people who did not receive subsidies before. So many of these increases for the exchange plans in the individual market will be masked to those individuals as a result of the increase in the subsidies. So, you know, in short, the subsidies override and mask any increase that the department approved this year for those plans for 2022. Now, having said that, and James led with the potential legislation down in DC, if ARPA subsidies do not become permanent, then we run the risk of a significant increase in rates in the individual market after the ARPA subsidies go away. So, you know, they mask them now, but there's a buildup of increases that they are not seeing right now because of the increase in subsidies. If those subsidies go away, it's not going to be pretty in the individual exchange market for premium rates.
It's a very important observation. Thank you for that. I appreciate it. Grant Ritter, I think, has a question.
Yeah, I do. Thanks, Paul, for the report. The one number that sort of like surprises me is the on-exchange small group, the number of covered lives in Anthem. Maybe it's a question for John Carbone instead, but I had no idea we had that many. You reported like over 25,000 there. You might go back to that slide. Maybe I misread it.
No, Grant, I didn't explain it well enough. Anthem participates both on the exchange and off the exchange in the small group market. And the lion's share of that 25,000 is off exchange small group.
Well, that makes more sense to me. Okay. It was marked as on exchange. That's why I was sort of like, what? Wait a minute. I wish we had 25,000 there, but apparently we don't.
Yeah.
Okay. The other question, and I don't mean to be facetious here, but did the insurance companies make too much money in 2020? And if so, is there any adjustment now which will sort of take that into a consideration? You said that you had to sort of like adjust the rates going forward because the utilization in 2020 was so low. But didn't that mean the insurance companies actually made more money in 2020 than they really should have?
Yeah. So annually, Grant, there is a MLR rebate report that comes out that will report just that. So as most everyone here will already know, that companies are held to an annual MLR rebate report that the feds administer. And individual and small group, they have to meet at least a minimum of 80% based upon the calculation. So in an instance where a carrier has not spent enough money on benefits in a given year, so we'll take 2020 as a perfect example, then we will see rebates in the report. And the report should be due out in the next 3 to 4 weeks, I would imagine, if it's consistent with prior years. There will be rebates that are provided back to both individuals of individual plans and small employers of small employer plans. And for that matter, the large group plans also have an MLR rebate report as well. And the large groups have to maintain at least an 85% loss ratio. So money does have to be given back to consumers if in a given year they have not spent enough money on the benefits to consumers. So we will know more about that, Grant, and the money will be given back to them. Two additional comments. One is that some of the carriers in 2020 did provide for refunds in 2020. They felt compelled to do that. They were not required to do it. And not all carriers did it, but some of them did refund premium to individuals and or small groups because they felt that it was needed right then and there, much more so than a potential rebate that they would have to pay out sometime at the end of this year. So that may lessen some of the rebates, and that was nationally. That was something that many of the carriers nationally did. So that may mitigate some of the rebate that might be paid out. And the last comment, prior to the 2020 report, there has not been an MLR rebate paid by any of these carriers you see on these charts from 2015 to 2019 in the individual small group or large group market, which indicates that consumers are receiving at least the required level of benefits from each of the carriers in each of the markets over the last 5 years. But we'll have to wait and see, Grant.
Okay.
Yeah.
Okay. Good explanation. That all makes perfect sense. One of the things that kept the carriers from actually having to give back money in the past is a 3-year moving average. Isn't there some kind of a rolling average
yes.
in calculation of that ML?
Yep. That's from the beginning. There's a rolling average. That's correct. That's how it was developed. Yep.
Great. Thank you.
You're welcome.
Grant, thank you. Ted Doolittle.
Yes, thank you, Mr. Chairman. Just to build on one of Grant's comments, I do note that You know, there are SEC filings that are available for many, if not all, these companies, perhaps not Harvard Pilgrim, but regarding amounts taken out of reserves. And when you do look at the United Health Group companies and the Connecticut companies in their last, I'm not sure what the technical term is, but the last amount of money that they removed from their reserves was substantial. I think in one case it was 76 million or so, in another case it was over 100 million. So there is some profitability there. I also would mention that several representatives, House representatives, spoke up at the rate listing session. And I would mention that Representative Nuccio from Tolland, a Republican from Tolland, had asked that the carriers consider on a compassionate basis operating essentially on a very low or no profit margin during this pandemic. I thought it was an interesting comment and well taken. Thank you for the additional time, Mr. Chairman.
Thank you for the information. Appreciate it. Any other comments before we let Paul leave us? Paul, thank you so much. It's incredibly valuable when you join us. We really appreciate it.
Great, thank you.
James, I think back to you for the Strategy Committee update.
Thank you, Mr. Chairman. Last Thursday, the senior leadership team and myself presented to the Strategy Committee at a very high level our initial discussion with the Strategy Committee to get their input, and we're going to have further meetings down the road. But I would invite the chairman of the Strategy Committee, Steve Hernandez, to give his perspective on what we presented and what the future looks like for us.
Thank you for that, James, and thank you, Mr. Chair. You know, what's really exciting is this process of continuous improvement that we're engaging in as an exchange is critically important. You know, it's no accident that the exchange is one of the most effectively and efficiently run quasi-agencies of the state. And whether we're expanding our options through a subsidiary, creation of a subsidiary, really expanding our cadre of trusted messengers through a broker academy, promoting entrepreneurship and community at the same time, and also addressing health disparities through information, to that information that is efficient and also accessible at every level. It's critically important to our mission. And then on the back end of that, also understanding that we always have to refresh and review what our mission is so that we remain a vibrant conduit for affordable health insurance. So I want to thank you, James, for all the work that you're doing for your vision here, and also the Strategy Committee in your collaboration. As you said, this is the beginning of a conversation. We will be meeting more frequently now in order to accomplish some of the strategic planning, which we will all bring back to this full board once we have a proposal. Thank you, James.
Thank you, Steve. Very quickly, you know, this past year has taught us how flexible that we have to continue to be able to make adjustments on the fly. This past year, we had a pandemic, we have the American Rescue Plan, then we have Cover Connecticut, where we have to pivot every other month, our IT, our operations, our vendors. So the strategic initiatives that we're gonna explore will make us more pliable so that we're able to respond very quickly, efficiently. Because as we just talked about, we have to add a brand new carrier to the exchange. And that required our system have to be adjusted to accommodate those changes. And we think there are more changes coming down the pike, whether it's from the state of Connecticut with the interest of creating products and services to service undocumented Connecticut residents, among other efforts that the federal government as well as the state are looking to do. So we have to be positioned and be ready to make those adjustments as needed for our customers as well as for the state of Connecticut. So as Steve Hernandez indicated, more to come on that. And again, I have a very strong, motivated team. Our entire organization is focused on continuing to further our core mission of lowering the uninsured in Connecticut for all Connecticut residents, as well as helping to address health disparities. We think the strategic initiatives help us address both of those core mission for Access Health Connecticut. Mr. Chairman, thank you.
Thank you. Any questions with respect to the update? In that case, if you would continue, James. Or I'm sorry.
Sure. Next, go ahead, Mr. Chairman. I'm sorry.
No, I'm sorry. Is it Robert?
Yes.
So
I believe it's Rob Blunt.
If we could, Rob Blundo, please.
Certainly.
Open readiness. Thank you.
Thank you. Good morning, everyone. So we're now approaching our 9th open enrollment, and despite 9 rounds of having gone through this open enrollment, there's always things that seem to make these open enrollment periods unique. With that said, it's certainly holding true for 2022. So I'll cover a couple of those things that cause it to be unique. I'm going to cover some of the major milestones in this next presentation, as well as some of the changes that we've made to help facilitate this open enrollment period. So with that said, let's dive in. The first thing I wanted to cover is just a reminder for the board. This is becoming, it was becoming traditional. However, there's a footnote here I want to talk through. This year's open enrollment period is scheduled to run from November 1st to December 15th currently. However, I want to caveat this. We're currently waiting finalization of the 2022 Notice of Benefit and Payment Parameters from CMS. And what this could do is this ruling could extend the open enrollment period to January 15th. So in the past, traditionally we would have open enrollment go from November 1st to the 15th. And based on past experience, we traditionally would extend to January 15th, depending on the circumstances. This would make the open enrollment period end on January 15th from the get-go. We're monitoring that ruling closely, and we'll keep everyone posted as that final rule comes out and it's finalized. As we prepare for the upcoming open enrollment, we have a few areas that we're really focused on, and I'll go into a little more detail as we move along here in the presentation. The first one is the American Rescue Plan's impact on newly affordable plans, its impact on pricing and value economics for consumers, as well as the impact on our renewal efforts. The second one is the Covered Connecticut program, which is another newly available benefit for Connecticut residents. The third one is recognizing the pandemic's impact on consumers and making sure that from a consumer, a customer service, and an employee perspective, we are prepared and we're moving nimbly and flexibly around that. And then lastly, the potential end of a public health emergency that we're currently in, which is currently extending coverage for a large number of enrollees. And that has a significant impact on not only our enrollees, but also our operational capacity if that does indeed end. So I'll cover that a little bit more in detail in the next slide or two. So Marcin, if you don't mind going to the next slide. What I'd like to do first is I'd like to just walk the board through our open enrollment project plan. I've consolidated it into essentially the major milestones that are going to occur for this month all the way through to the end of December. In addition to this, as I walk you guys through the milestones, I put an envelope symbol next to each major milestone that results in significant consumer communications. Those are critical to recognize, as those will contain some significant information for our consumers that will impact their 2022 enrollment. So let's dive in. So for the first, starting off with this month, as Paul has just mentioned, the 2022 rates have been filed, they've been finalized and made public. So this allows us back at Access Health to start moving forward with 2022 plan configurations and the implementation of those plans. Earlier this week, we also started our first wave of new call center representatives training, and that's actually completed this week. So the first wave of multiple waves is completed. Those folks are going to start getting integrated into our call centers. In addition to that, tomorrow, our online training for brokers and assisters will be beginning, and that'll go live. This is annual training and certification that's required for 2022, and it needs to be completed if the brokers and assisters want to operate within the exchange for the next year. Beginning in October, on the 8th, we're scheduling our final major release of the year. What this will do is it'll implement a variety of improvements to our system in preparation for this open enrollment. And after that, we will be freezing our system. And essentially what we'll be doing is after that freeze, all focus is placed on making sure the system's stable and prepared for a successful open enrollment period. On the 18th, we'll begin to run our projections for folks to renew from 2021 to 2022. And this will also result in notices to those consumers. Essentially what these are projection notices that will let the consumer know essentially what we are anticipating to happen regarding their auto renewal or active renewal for that matter. Those notices will tell them whether they initially qualify or are projected to automatically renew, as well as what their projected 2022 premium will be if they remain in the same plan. Shortly after that, on the 25th, we'll be opening up our window shopping for 2022. So as a reminder, what window shopping does is this will allow folks to come into our web portal and actually look at 2022 plans before open enrollment begins. We've received positive feedback on this from the brokers and the CACs and the communities who are really appreciate that extra week to start looking at rates. The reason why we open it up a week before is really it's a fine balance between giving ourselves enough time to prepare ourselves for 2022 displays, as well as making sure that we give adequate time to those folks who want to get in there early. So we traditionally find about 1 week is about the sweet spot to open it up to balance risk versus reward. On the last week of October, we'll be activating those brokers and assisters who completed the 2022 certifications, and our last wave of call center representatives for open enrollment will have completed training at that point. Moving into November, on the 1st of November at 12 a.m., we'll be opening up our 2022 plan year 2022 shopping portal, which at that point, consumers can come in and essentially start shopping around with the full experience. They can enroll in a January 1st, 2022 plan and essentially have the full open enrollment experience. In addition to that, our marketing team will start their OE campaign, which Caroline will cover in more detail shortly. On the 18th of November, we'll be conducting our actual automatic renewals for 2022. So again, folks will have gotten that projection notice roughly a month before. At that point, they will get another communication which will indicate to them whether or not they successfully automatically renewed into their 2022 plan. Even after that, consumers can still come in between then and the end of open enrollment to change their plan. But this will impact roughly 80% or actually north of 80% of our customer base who traditionally automatically renew and qualify for that. In December, we'll be shifting our retention efforts to focus on consumers who actually haven't renewed for 2022. So what we mean by that is the folks who don't qualify for automatic renewal, who have to take active action, we'll be really focusing on those consumers to make sure that they recognize if they don't take action, their coverage will end on the 21st, on 2021. And at that point, they will go without coverage starting January 1st of the next year. So we'll be ramping up our attention on those individuals. On the 15th of December, as I mentioned earlier, we're expecting open enrollment to end, although again, this is subject to change as that rule is getting finalized. And then the last thing I wanted to cover is traditionally we get questions around, when will consumers get their benefit cards? When will they get their bills? And traditionally we find that happens usually within about 2 weeks of the consumer completing their enrollment through our exchange. So first invoices for the 2022 plan year traditionally will start hitting mailboxes or email inboxes between the 15th of December to the 31st of December for folks who've enrolled already for 2022 plans. All right, so on this next slide, what I've done is I've broken out some of the expected challenges we have coming up during this open enrollment period. Some of these challenges are challenges we face yearly, regardless of the year it is. These are just ongoing open enrollment challenges, and then some of these are very much specific to 2022. So just as a reminder, I just want to call out the things that we keep our eye on and we currently work through on each open enrollment, regardless of year. The first one is this unique business model we operate in where we essentially service and enroll approximately 80% of our customer base within a 45-day window. So as you can imagine, that creates some pretty big challenges from a staffing perspective and a customer service perspective. So we have a variety of mitigation strategies for this. We nearly double our call center staff. We ramp up monitoring of our systems. This is really the busy time of the year for us from a customer service perspective, as well as from a technology perspective in terms of making sure everything is running. In addition to that, each year there's a variety of factors that impact potential premium changes, as Paul just alluded to. A lot of those major factors are income changes for consumers, changes in the benchmark plan pricing, So the good news is, again, this year with ARPA, or the American Rescue Plan, much of that will be blunted. That will certainly help with pricing between 2021 and 2022. In addition to that, many of our consumers have already benefited from ARPA's impact. However, we continue to monitor this, and what we will do is we will be sharing a report with the board a little later this year, which actually shows what those price increases at a consumer level actually look like. So more on that to come. That will be closer to the end of October when we share that. From a product offerings perspective, in the past years, we've had challenges in the sense that, plans are discontinued, then consumers lose the ability to automatically renew. They have to come in and manually select a plan. We're lucky in the sense that this year is a pretty stable year. We have no discontinued plans. All of the plans are currently crosswalked from 21 to 2022, so consumers can find a plan that's very similar to theirs, or essentially the same plan. And this year also has the addition of those Chi-Chi plans, the new Connecticut entity. That plan itself will be added. It'll be a third silver selection, which will be different than last year, where we only had 2 silver standards. In addition to that, that plan will also help individuals who are currently off exchange. That plan will be very similar to the Connecticut off exchange plan, which should help consumers who are off exchange and considering coming on exchange to benefit from ARPA. It'll be a little easier for them to find a similar plan if they decide to stick with a similar plan. The last yearly change or the last yearly challenge that we're focusing on is really complexity in healthcare. Customer confusion is, it's no shock that consumers are just confused by the healthcare system we have. It's just complex. So we continue to endeavor to simplify our communications and do our part to alleviate some of that complexity. But at the end of the day, that's still a challenge that we and other healthcare entities are constantly working through. From a challenges perspective unique to 2022, I just wanted to cover a couple of these. First is obviously we're in the middle of a pandemic, so this is going to carry a couple of different challenges related to that. The first pandemic-related challenge is really just the behavioral economics, the purchasing pattern of consumers. We monitored this last open enrollment and we'll continue to measure it and plan accordingly for this open enrollment. Certainly saw some changes in the way plans are being purchased and how folks are in the retention efforts, as well as plan coverage changes throughout the years, throughout last year. In addition to this, the new Delta variant has introduced some additional barriers to providing in-person assistance. So again, our organization's working through this. We're trying to get clever as possible in terms of how we service the segment of consumers who really want that face-to-face assistance with their policies. We also continue to move nimbly to align our technology and our operational processes to the fact that there are policy changes related to the pandemic. There's internal policy changes to make sure that we can staff appropriately and that we can be in office or work collaboratively in a remote environment, et cetera. And then lastly, we're seeing really an impact on a couple of different things, including the federal hub data that we rely on, which is critical for our ability to renew and redetermine eligibility for consumers, as well as consumer actions that are required, oftentimes when consumers have to verify information. So one of the issues we're currently monitoring is how we receive MAGI income through the federal hub. So there's been changes with the way CMS and IRS, they have been easing the premium tax credit reconciliation requirements for plan year 2021 and 2022. The result of this is the data that we receive through the federal hub has actually been impacted. So in a worst case scenario, this could impact auto renewal rates. This could increase the verification load for our consumers. So we're working quickly through this. We'll have completed our assessment of the impact of this data change by the end of this week or early next week. Once that assessment is completed, we'll begin our mitigation planning. So far, I'm optimistic that it won't have a significant impact in Connecticut, but we really need to complete this assessment to fully understand the issue and really close the issue out. So we will keep the board posted on this one. If there is going to be a significant impact on our renewal rates, we will certainly be keeping the board posted. The second major challenge for 2022 is the ARPA impact. This one, I just wanted to call this out. So while ARPA has resulted in over $5.5 million in monthly savings for Connecticut residents, making those plans more affordable, we are approaching this open enrollment with essentially, I think this is kind of a good challenge to have. We're trying to balance out the ease of auto renewal versus the potential savings from consumers actively shopping for plans. And while this has always been a challenge each open enrollment, I think it's especially pertinent this year with those additional ARPA subsidies. So our analytics team will be working closely with our marketing department, where we're going to be making sure that we identify those consumers who could be potentially leaving significant premium tax credits on the table, and making sure that they recognize the benefit of actively shopping and really understand that there could be a significant value added if they reassess their plans in this ARPA world. And then the last challenge is this potential end of the public health emergency. So as a reminder, the public health emergency essentially allows us to extend coverage for a variety of reasons within Husky. Its impact has been significant over the last year and a half to 2 years. Over 170,000 enrollees are currently have extended coverage in Husky. If this public health emergency actually ends on 12/31 of this year, we will have a duration to help roll those individuals off that extension. We will be working closely with the Department of Social Services. But at any rate, when you have close to 170,000 enrollees who will essentially have to redetermine eligibility, potentially not be eligible for Husky, potentially roll into a QHP plan, they may potentially end up in an uninsured pool, who knows? We will have a significant operational load to make sure that we try to retain those consumers, we try to educate them, we try to make that process as simple as possible. So we're monitoring it. We don't know if the public health emergency will be extended yet again. If not, we're currently having conversations right now with the Department of Social Services to actually plan that rollout of a transition in the event that it indeed expires at the end of December. And I just wanted to close out briefly, just Marcin, if you don't mind, if you can go to the next slide. Thank you. We have released numerous improvements over the last year, which will make this open enrollment period more successful from a technology perspective. We've got over 100 improvements that have been implemented on our system. Just to cover a few, we now have a revised homepage, which has been newly improved. It's been synced up with the rest of our web experience. We're far more nimble in terms of how we can actually update it and provide open enrollment messaging and information. We've also rolled out an entirely new knowledge base, which will help us in our 100% self-service goals for consumers. So we're excited about that. In addition to that, we've removed almost 10 pages from the application process, which will significantly reduce the number of clicks that consumers have to click through, as well as the information they just have to review as they complete their application. The goal there being, if you can shorten up the application process, consumers are more likely to complete it because it's easier and ultimately get enrolled. We've got substantial improvements to data quality and integrity, so that'll help us both from a 1095 perspective, as well as making sure that the carriers can bill consumers accurately and reduce consumer friction from that perspective. And lastly, I just wanted to cover, we've spent quite a bit of time updating our system to support all the policy changes that stem from ARPA, as well as the Covered Connecticut program. So we're excited to roll into this open enrollment period to have not only the ARPA changes and benefits implemented, but also the Covered Connecticut program. By the first week of October, that 8th release date, we will have visual feedbacks for Covered Connecticut. It'll be a much more seamless process for consumers coming through and determining eligibility for that program. So we're very excited about that as well. So with that said, I'm gonna close out with this slide. I'm happy to answer any questions if anyone on the board has any. Thank you.
Rob, thank you so much. I'm actually going to interrupt you just a moment, but I will allow questions. Tom McNeil, are you still with us? Tom?
I am still with you. Yeah.
I'm conscious of that you may need to leave us a little bit early today, and I want to make sure that we don't lose you before we have our executive session. So, do you have a few minutes still?
Yeah, if we could move to executive session, that'd be great.
If the board would indulge me on that, just because Tom's critical to the executive session. So, Rob, let me say thank you. I know you're coming back on another agenda item just a minute. So if people would be willing to hold comments to your last presentation, maybe add them to your next presentation. And again, with the indulgence of the board, I would like to just change the agenda slightly so that we can move to the executive session now, again, because Tom McNeil is important to that. So if you would permit me to do that. And I believe, Marcin, that that executive session requires a vote. So with apologies again, I think I need a roll vote to move to executive session. And I would vote yes for that.
Mr. Chair, you have to indicate the statute number again to go into executive session.
My apologies. That means I have to look up the statute number again. So I will. The statute number is section 1-200, subsection 6, subsection A, that permits exempts from public disclosure discussion of an officer and a public officer or employee.
Is there a motion?
So moved, CC.
Seconded.
Paul.
A roll call. Charles Klippel.
Yes.
Paul Philpott.
Yes.
Gregory Messner.
Yes.
Deidre Gifford.
Yes.
Graham Ritter.
Yes.
Steven Hernandez.
Yes.
Theodore Doolittle.
Aye.
CC Woods.
Yes.
Thomas McNeil.
Yes.
And Mr. Matthew Broughton.
Yes.
Thank you. And the board members, please disconnect from this line and join the executive session line. After the executive session is over, please disconnect from the executive session line and reconnect to our regular line. Thank you.
For all our guests, thank you for indulging us here.
Alessandra.
Hi, everybody. We're coming back.
Thank you, Mr. Delano.
All right. Thank you all very much for indulging a delay here. And I think the directors who are in the executive session are rejoining now. So we will, I believe they're back. Looks like everybody's back now. So again, thank you all. And taking this issue again slightly out of the order of the agenda, I would turn to the head of the Human Resource Committee, Tom McNeil, to make a motion for us to consider. And Martian, you can tell me if I've got the procedure here correct.
Yes, that's correct, sir. If the board wants to take a vote following the executive session, the chair will request the chair of the HR committee to make a motion for the vote.
Okay.
Thank you, Tom. Tom, if you would, please.
Enter into a amended contract with the CEO of Access Health.
Tom, I think you broke a little bit there, but you're not. Your motion is to authorize the Human Resource Committee to enter into negotiations to amend the contract of the CEO, and that's the motion on the table. Second.
Second, Deidre Gifford.
Thank you. Moved and seconded. Could we have a vote to support that motion?
Yes,
this is Charlie Klippel, yes.
Paul Philpott?
Yes.
Gregory Messner?
Yes.
Deidre Gifford?
Yes.
Grant Rader?
Yes.
Steven Hernandez?
Yes.
Theodore Duodo?
Yes.
CC Woods?
Yes.
Thomas McNeil?
Yes.
And Mr. Matthew Brackman?
Yes.
Thank you so much.
All right. Again, thank you all very much, and appreciate it. We'll go back to our agenda, which I think Rob, if you'll allow me, let's move to Carolyn and Tammy, and then when you come back, if there are questions lingering from your last presentation, I don't want to cut them off. So, but if that's okay with everybody, then Carolyn Lee, Tammy Hendricks, let me start by saying again, welcome, and give the floor to you.
Excellent. Thank you so much. Good morning, members of the board. It's a pleasure to be here in service of the mission. I personally look forward to working with you and keeping you informed. We're going to start our marketing update today with a review of the Covered Connecticut program. As you know, this came down very quickly, and I just want to ground us all again now that we're back together in what this program is. Ultimately, some Connecticut residents that meet specific eligibility requirements will be paying $0 for their health insurance through Access Health Connecticut. This is made possible by the state of Connecticut, who is going to pay the premium amount and the cost sharing that a customer would normally have to pay for their plan. It's an excellent opportunity, and we're working on getting the word out there and have made significant progress since we launched July 1st. So let's talk about where we started, where we are today, and what's next. In front of you is a brief overview of really how we started in July. To get the information out there, we completed a very comprehensive Q&A that was posted to our website in both English and Spanish. This is that kind of platform that Rob alluded to earlier. It's Q&A, and it really helps our customers have a better experience online by giving them a lot of information in that Q&A format. That said, we wanted to make sure that this had a lot of high visibility, as folks might have been hearing the term Covered Connecticut out into the market. And in order to get people to that comprehensive information, we also made a blog post that was pinned to our website, and it's still there. That's in English and Spanish, so it has high visibility as folks are coming online. It's also a little bit more high level, right? And so it's 3 things every resident should know about the Covered Connecticut program and a blog style, and then it links out to that Q&A for more information if that's what the customer needs. In addition to that, it was very important, especially at the launch and as we continue to move through this experience with our customers, as our system is not automated yet, that we have good communications directly with those folks who are immediately eligible for this program. So what we're doing right now and what we've been doing for the last several months are manual monthly auto enrollment polls with communications directly to those customers that are eligible. We'll go through a little bit more of that information in detail on a following slide. However, it's important to note 2 other tactics that we undertook towards the launch that were supporting this as well. That included participation in press conferences alongside elected officials, as well as a legislative toolkit that had content for websites, emails that these folks put out, their social media channels. And that's particularly important because we need to communicate directly to the audiences, right, that can be eligible for this program. But we also need to communicate with the folks that influence them. Those are the folks like the elected officials, trusted nonprofits, and community partners within their own communities, where they go for this information if they're not coming directly to us. And so it was important that our launch strategy included those initiatives. Martin, next slide, please. So this is some more information about that direct-to-consumer marketing that I alluded to previously. We are doing those monthly manual polls of the folks that come into Access Health that are immediately eligible. We communicate to them about their new benefits through email if we have that. It's not a required field for us. However, it's much easier for us to activate those things quickly, right? Because email is a digital channel, we can hit send very quickly. So when time is of the essence, as it has been with this project that came down quickly, we wanted to make sure that we utilize that tool. Again, we don't have an email for everyone, so we need to lean on our direct mail services when necessary. That is something that we have for all of our customers. So all of those that were immediately eligible for the last several months have received both emails for us if we have that, as well as direct mail communications. If anyone's out there talking to, other community partners, people in the public that might be eligible, they would receive this information from us in the mail in a blue envelope. And just having that color is a good way, especially as we talk with other people that influence these communities, to be able to reference the communications. So I wanted to point that out today. In terms of that immediately eligible population, there were 561 individuals at Access Health CT in July. In August, it was 28, and it's increased now. Our September number is 196. Next slide, Martin. So now let's also kind of take a look at what we're doing to increase awareness about this program. So we are doing a campaign that's in market for September and October, and it's a dual message campaign. Took some time to get this together to make sure that we were being strategic as, the Covered Connecticut program was launching. We're also getting news about the continuation or the extension of the special enrollment period. So 2 really important messages that we need to get out into market. And what's interesting here is there's 2 different deadlines, right? For the SEP, the enrollment deadline is October 31st. And for the Covered Connecticut enrollment deadline, folks have until December 31st to enroll or the end of open enrollment. And so we've got 2 different things that folks can pay attention to with 2 different deadlines. So we needed to be strategic about how we were getting those messages in market. Ultimately, this is where we've landed. We are having digital billboards in Hartford and New Haven. What's great about this tactic for a dual message campaign is we can actually toggle and shift between the messages that are on the digital billboards. So at certain times, there's going to be the Covered Connecticut message, and at certain times, there's going to be a message about the extended special enrollment period. We can be very nimble with this messaging and change it out as is needed. And that's a really great way to kind of attack this challenge, right, of a dual message campaign. In addition to that, we have print advertorials that are running in the Current, as well as several multicultural papers in both English and Spanish, wanting to make sure that we're getting this information to all corners of the state. What's great about this advertorial opportunity is, again, leaning back to that dual message campaign, multiple deadlines. It's very easy for reporters to make mistakes, get deadlines wrong for the different programs. And so buying this content, creating the content in a feature article style allows us to ensure that the messaging is correct, that the right deadlines are there, the right information is there for the public, and tight turnarounds like we have for both of these different campaigns that we need to be supporting right now. We also have DJ radio reads. These are taking place on WMPR, WPOP, and WTIC. These are news talk stations. So as I alluded to earlier, we have two big audiences that we need to communicate to. We have the folks that could potentially be eligible, and we need to make sure that they know about the program, but we also need to make sure that those who influence know about the program as well. Those elected officials, nonprofits, that are within their communities that these people might go to instead of coming directly to us for information. So you'll see the different tactics here within this campaign reflect both of those audiences to make sure that we're reaching them really well. What I really like about the digital or the DJ radio reads as well is the fact that these DJs have relationships with their listeners. They are more trusted. So having them as conduit to share our message and add some validity behind it is a really excellent way to champion that message. On top of that, we've got some really excellent social media. As we're all living in increasingly digital lives during this pandemic, it's important that we're pulling that through. It's also a channel that we know reaches our desired audience. So we've got social media advertising as well as what we call organic posts. So just those typical posts that we might make and people who follow us might see, but we're putting some money behind this, making sure that we're reaching people throughout the state that might not even be following us, and so they might not see those organic posts. And then we also have search engine marketing. This is particularly important because it's when people go to Google or Bing and they type something into search, it's really what appears on that first page when people get the information that they're looking for. So we have some money behind that to make sure that we're really rendering on that first page of content towards the top. So if somebody hears about Covered Connecticut on the radio, for example, maybe they consume some of the advertorial content. If they use that term Covered Connecticut or Covered CT and they put that into a search result or into a search bar like Google or Bing, what is the information they're getting back? And by having some money behind it there, we're making sure that we're controlling the message and delivering the content that they need. Over to the right are just some examples. Sorry, Martin, can you go back just a little bit? Thank you. There's just some examples of some of the content that we've been talking about. If anybody is interested in looking at the creative or having more of an understanding of that, we can certainly provide that in more detail. Okay, Martin, you can move forward now. Thank you. All right. This is important too. Where are we going? So there's some significant areas of opportunity that we are moving forward with to continue to raise awareness about this program. First and foremost, we're going to continue with the prominent placement of blog post content and that website Q&A on our site, especially as we approach some of the heaviest traffic times of the year. And I also want to point out, it's the second bullet here, I don't want it to get buried. It's very important to note that come the October release for our system, folks will be able to go online and see these savings themselves. So they're no longer going to need to call the call center in order to see the immediate savings, which is the current solution. And so really looking forward to that release in October. And when that release happens, so when people will be able to go online, shop, compare, and enroll and see that $0 plan responsibility from themselves, They'll also get automated eligibility notices. So the ability for us to be more nimble and rely on that automation to get information out to our customers is coming, and we're excited about the opportunity that that's going to provide to Connecticut residents to be informed more quickly. On top of that, there is an opportunity to do some outreach to households that may be eligible if they make a plan change. This is a hugely important area of focus for us over the next couple of weeks and months as we work together to get people more aware of this program and the benefits that it provides to them. So we are going to be working with the carriers, Department of Social Services, as well as the Office of Health Strategy to make sure that we're getting in front of the right folks that might need to make a change to their plan in order to be eligible. So what does that mean? When it comes to Covered Connecticut, there's several pieces of eligibility criteria. You have to be in a certain income bracket, and then you also have to have, at least one dependent child in the household under age 19. And then, of course, folks need to be using 100% of their advanced premium tax credits, cost sharing reductions, as well as the financial help available through the American Rescue Plan Act, and they need to be in an eligible silver level plan. So lots of layered criteria here that folks need to match in order to be eligible. So there's probably people that meet that FPL and have children, but they just need to opt in to use 100% of that financial assistance, or maybe they bought up or down. They're on a bronze plan or a gold plan. Let's get them on that eligible silver level plan so they can take advantage of this opportunity. So we'll be working with external entities to make sure that we're reaching out to those folks who could be eligible that just need to make some changes. Additionally, we're going to look for ways to support communications during the OE cycle where we can typically insert messages. For example, press releases, talking points when we have opportunities to engage with reporters, really weaving that in, again, during that kind of high traffic time of year where we get some more attention. All right. So after we reviewed kind of where we've been, where we are today, and where we're going with Covered Connecticut, wanted to put this slide in front of everyone. This is the fiscal year 22 advertising calendar. So the thing that I want to point out here is that this is the paid content. So what you see in the orange color to the left is the paid media that supports the American Rescue Plan Act and the special enrollment period. Yellow is that extended special enrollment period and Covered Connecticut program. This is when we have mass media content and market that we've paid for. So you'll notice that that yellow that includes Covered Connecticut doesn't start until mid-August. That's not to say there wasn't anything done, right? We used a lot of our owned media, website, direct mail, email ahead of time. We're now moving into a part of the calendar year where we can support this with paid media. Then in green, you'll see this is where we have open enrollment. Since it's not been 100% decided yet, that's why that area between the end of December and the beginning of January is that lighter green color. And then we also have some in gray. We're going to put a significant level of effort behind our paid media to support brand and health equity this year. We're making a lot of improvements to how we're supporting that secondary part of our mission, and we're making sure that paid media and marketing is in support of that. And so really, this is just a great visual to show that, we're not just in that OE mentality. It's really about, changing hearts and minds and getting that awareness throughout the entire calendar year. So again, I just want to make sure this slide isn't misinterpreted. This is just the paid media. It doesn't mean that other tactics weren't being used to support these various campaigns in other timeframes. Okay, Martin? All right, so, as we're rolling through where we are today, where we've been and where we're going, wanted to provide an opportunity just to kind of get a sneak peek and an update on where we're going with open enrollment creative, so our paid media and the creative behind that. This is where we're at today. We've got 4 creative concepts that we're working on. Focus groups took place August 31st and September 1st. So really a review of that is we're not our target audience oftentimes. So we need to make sure that we're testing our creative and making sure that the concepts and taglines and content and the people in our ads, that they're going to resonate with our target audience. So we actually put those in front of real people in several different demographic groups. So we're working on the feedback right now. kind of going through it to revise our concepts and kind of come out with a front runner. But just so everyone is aware, these are the types of people that we're putting the concepts in front of. We're putting these in front of our existing customers as well as non-customers. That includes leavers of unemployed, underinsured, and uninsured folks. We're putting this in front of Spanish speakers. We're putting it in front of Stribers, and that particular group, the name's a little hard to understand. So Stribers are mostly ethnic mix of Hispanic, Latinx, Black, and African American folks with moderate education, and they're struggling to make ends meet. So we're getting those folks in there, as well as the affluential folks. So these folks stem a little bit older, they're a little bit more well off, so we're getting their opinions, as well as young achievers. And these are folks that there's some singles, there's some families, they're kind of rising up the economic spectrum. So we're putting this content in front of a variety of different people. These are our target audience, and we're making sure that we're taking their feedback into consideration as we revise the creative and get it ready to support open enrollment. So a lot going on between Cover Connecticut and OE Prep. But we're keeping things moving, and I hope that this provided a little bit of clarity on where we're at and where we're moving going forward. I'll go ahead and toss it over to Tammy at this point in time to talk about how outreach will participate.
Thank you so much, Caroline. Good morning, everyone. I just wanted to say how excited I am to be here and to have the opportunity to launch this new health equity and outreach department. For now, we're continuing our outreach while creating some more initiatives towards lowering health disparities in Connecticut. So it's such an exciting time for our department and Access Health as an organization. So our department will continue its outreach efforts. Obviously, we're ramping up for open enrollment, targeting communities with high uninsured rates. And of course, those communities tend to have higher health disparities. So we'll get into the community outreach on the next slide. But on the health equity side, we are looking forward to partnering with other departments within Access Health on initiatives directly linked to reducing health disparities. The first being the Broker Academy, which our department will be partnering with marketing and SHOP to launch this program. And the objective of the Academy really hits home for our health equity department, and of course for our core mission. It ensures that communities will have access to local brokers that they can relate to and most importantly trust. This will then positively impact, the health of the community members, but also adding that economic benefit through job creation. So we're really excited to work on that. For the next part of health equity, we will be promoting our new health equity webpage, which recently launched. Thank you, Rob, and the entire team for getting that done and really giving us a good foundation to continue to build on. There's more work to be done, and obviously, as we add information and change, we will continuously update the site. Rob will actually give us a quick walkthrough of the webpage shortly after my presentation. But for right now, we're starting to implement phase 2 changes, which will include translating the page to Spanish, adding a contact form. So we want to get information for our marketing department. We want to expand the relationships with our community partners and the general public. Here's all this information, all this data. We need your help to make an impact. So this will be a really great way to open the lines of communications and gain more support for our mission. We are also working on creating a health equity blog post, which would outline all what we're doing to further our mission and also get people engaged and informed on our current outreach events. And finally, we are working with our marketing team to develop a toolkit to further educate and raise awareness. So the health disparity study will really be the foundation for our future department strategies. Marcia, next slide, if you could, please. Okay, so moving to our community outreach, we continue our extensive outreach efforts. So far, we have completed 54 events in key target areas spanning across the state. Our goal is really to have events in every county and multiple in targeted areas identified for having high uninsured rates. Really continuing to get to those hard to reach communities, which outreach has always done. Our Navigator program is going great with our partners at CRT and Project Access in New Haven. These navigators are still working closely with our outreach team. They are attending and hosting events on our behalf. They're assisting in year-round enrollment support and engaging with other community partners as well. So they continue to be great allies for us, and we enjoy working with them. Our Healthy Chats are continuing our series of educational chats for consumers and community partners. We have a running total so far of 23. Of course, we will be adding more for open enrollment. But these presentations really just outline general information. What is Access Health? What is the American Rescue Plan? Where can I get enrollment help? Customers are able to ask questions, so it's very informative and interactive. And they're offered in both Spanish and in English, so we can cater to both groups. The next chats are scheduled for Tuesday, October 12th, and Wednesday, October 13th, and I believe there is one at the end of the month. So 2 chats in total in English and 1 in Spanish. Finally, coming into the department, this was kind of something we had to go back and forth with because of COVID. We're continuing to secure enrollment fairs and locations. So far, we've planned for 5 locations and 25 fairs, so a total of 30 events for our open enrollment season. Now, we are planning for in-person events, but due to the uncertainties of COVID, of course, we have planned and we do have the ability to go virtual if needed. But we know how highly attended these events are, and we know how important it is for our customers, especially in underserved communities, to get that one-on-one in-person help. So our aim is always to have these events in person and pivot as needed. Of course, we're taking all the safety precautions. We have them in place to protect the staff and consumers as well. So we're offering block scheduling to limit the flow of people into the event space. We are all wearing masks. We have plexiglass on the tables to separate the customer and the staff. So we're taking all the precautions to have safe events here. Martin, next slide, please. Okay, last update, we've been working extremely hard on our community conference, which we essentially had to recreate. This event will now be virtual, held on October 19th, starting at 9 a.m., and it will be professionally broadcasted. So this year, it will be a shorter event. I know in the past it has been 3 or 4 days. It will be a half-day event, but we're really planning more meaningful, engaging educations for our community partners. We have chosen a keynote speaker. It is pending right now. We are awaiting her response. We've chosen Marietta Vasquez, Associate Dean of Diversity at Yale New Haven. Her professional experience with diversity and inclusion would really give our attendees and community partners great insight. So we've reached out to her, and we are still waiting for confirmation on that, but we're really hoping that she can make this event. We've also chosen a recipient for the Community Award, which will be announced at the event. This organization has done so much for underserved communities throughout Connecticut, and they've really worked closely with our outreach team. So this award will be well earned, and we're looking forward to presenting it to them. So we're really looking forward to this event. It's different this year, but certainly will not disappoint. I hope all the board members can attend. So far, we have 133 people already registered. So I don't doubt it will be a great turnout. And really, that's all the updates I have for now. And I look forward to keeping you updated on the new projects and initiatives as we plan them. Of course, I'm building this department, so there will be more changes to come. So I'm open for any questions if you have any.
Thanks to both of you. And Commissioner Gifford, you have a question?
A virtual hand up. Yeah.
Yeah.
Tammy, nice to meet you. Deidre Gifford from the Department of Social Services. Welcome.
Thank you.
What I wanted to suggest, or at least put on the table for consideration, is teaming up some of your community events with our vaccine outreach teams and or our testing. So as you know, we use the same contractor as Access Health, Grossman Solutions, to do our outreach for our vaccination clinics and our door knocking campaigns.
Yeah.
And it would be wonderful if we could have next to your or alongside your events an opportunity for people to get vaccinated and or tested. And so that we have 35 cars available every single day. We should be able to make that happen if there's an interest there. And Grossman could potentially work drumming up interest for your community fairs and vaccination at the same time. We might be able to kill two birds with one stone. The other thought is for your event, which looks terrific. We would love to be there, we being DPH, the vaccination program, as a community partner, so that other community organizations that are participating can learn about our mobile vaccine program. That boosters are going to be coming online at some point for some population, coinciding with open enrollment. So, and we are targeting, importantly, much of the same populations with our work. So it would be great to buddy up. The person you want to speak to at DPH, Tammy, is called David Reyes.
Okay.
And you can just let him know. You can email me, or you can just let him know that I suggested the two of you brainstorm about ways to work together.
Of course, and that's part of the health equity side that I'm really working towards. Is, you know, we have a lot of community partners, but really expanding on that partnership and doing things together. We've done it in the past, but I really want to focus on that more moving forward. So I look forward to connecting on that. Absolutely.
Thank you.
Dr. Gifford, yes to everything you said. With the exception, maybe space limitations might limit our ability to do more with DPH and DSS and other organizations that we've partnered with them over the years. But absolutely yes to everything you suggested. Thank you.
Yeah, and the vaccine van can be outside too if you have indoor space limitations. So just to put that on the table, but totally get that, James.
Great.
Thank you.
Ted Doolittle.
Yeah, thank you, Mr. Chairman. First, I just want to say hi and welcome to Tammy and Lee. It's great to have both you guys on board, and thank you for the presentation. My comment is going to be brief, does hark back to Rob Blundow's presentation. I was really heartened to see that the coming wave of redeterminations that we're going to be dealing with is on your radar and the staff's radar. I just wanted to flag that as a #1 concern of myself as a director over the next year or two. We have to get that right. We have to make a low stress transition as possible for our families. I know we will, we're poised to do that. I just want to publicly mention that and thank you for starting your thinking on that. And I know that DSS is thinking about that as well. It's going to be a big challenge, and I know we can get it right, but I just wanted to flag that as a top concern, something that we are going to get right. I know we're going to get right over the past year or two, but we want to keep getting updates from you guys like Rob Blundow's. Thanks so much, Mr. Chairman.
Thank you. Matthew Brockman.
Yeah, thank you, Mr. Chairman, and great to meet both of you. Thanks for your presentations. one question back to the sort of Covered Connecticut program. So I think one of the goals was the estimate of how many people were going to be in the program was somewhere around 40,000 back when we did the budget. And sort of looking at knowing that it was a rollout that did not get lots of advertising at the very beginning. Right now we're in a place where we're at less than 1,000 people currently in the program based upon the numbers from before. And I'm wondering how realistic it would be to get to, I presume we're not getting to 40,000 by December 31st, but where do we think we're going to get and how can we expand that, I guess?
Thank you very much, Mr. Brockman. Hey, Rob, can you get some context around the numbers that are potentially out there?
Yeah, definitely. So it's a good question. I think the answer to that is complex and challenging. And the reason why I say that is there's a couple of components, both from a policy perspective and from a measurement perspective, that we need to take into consideration. The first is between now and July 1st of 2022. That's essentially the component of the bill that focuses on parents and caretakers only, which means they need to have a child below the age of 19. They need to be a parent or caretaker of status, amongst other requirements. Caroline covered the other requirements, which, you know, obviously they need to take advantage of the ARP subsidy. They need to be in a silver plan, et cetera. Currently, there's 1,000 QHP enrollees that currently meet that criteria, meaning they have a child in their household that's under 19. And we've got a substantial portion of those folks who are automatically enrolled and automatically eligible. If we were to take a look at that pool and then look at, let's say, even the Husky population, so looking at the data that we have, and we were to take into account anyone within that FPL band and anyone not taking into account whether or not they are already enrolled in Husky or QHP or coverage through an employer, there's currently 7,000 Husky households within this FPL range. So with that said, and it's 7,000 with a child under 19. So that should put it into context. We're currently in our database of pools of individuals that we could reach out to. It's about 8,000 individuals. If we were to cast an even wider net from that and say, okay, let's go out to data that we don't have, meaning if we were to look at the full pool of individuals, we could look at census data, but and census would give us the uninsured population. However, even that is challenging because census data, first of all, it's estimates. Second of all, there's no way to stratify the census data, at least with publicly available data, to stratify it by households with children under 19, households who are parents or caretakers, or particularly even the FPL band of 160 to 175. So just to put this into context, if we were to look at the census insured household units or uninsured household units that fall between an available FPL band, which is 139 to 249%. So obviously much wider than the FPL band that the policy currently focuses on. There's 34,900 estimated uninsured households within that FPL range. So I don't know how to get that number down to 160 to 175, but obviously it would be something substantially smaller than the 34,900 that are currently estimated within that full pool. I think the other thing to keep in mind is the other component of this policy, which is, the component that's set to come into effect on July 1st of 2022 would be the removal of that parent caretaker requirement. It's a loosening of the FPL. So essentially it goes from 138 up to 175 for folks who are ineligible for Medicaid. At that point, I think we start seeing some larger numbers. So an example of that would be the potential QHP population who could benefit would then increase to about 10,000 current enrollees. Obviously the Husky number, we could start casting a net there for the data we currently have. That number would be larger than the 7,000 that we referred to. So the short answer is it's complex. The short answer is it's even more complex when you take into consideration the complexity of the uninsured and getting them to cross the line to become insured. But I hope my answer at least gives you some idea of some of the estimates of the population we currently know and the population that currently is out there that would really have to be targeted for acquisition purposes.
Mr. Brockman, very quickly, obviously, the crux of success is communication. And this is probably one of the hardest populations to reach into. So we're going to leverage our health equity and outreach team to go into the communities, knock on doors if necessary, but leverage our partners, the navigators and other community partners to get the word out. In addition to everything that Caroline talked about earlier today, but again, it's about getting into those communities, knocking on doors. The mass media is not going to do it. Those are folks there get the information through very narrow channels in their communities, the churches, the barbershops. So we are going to we're going to be very aggressive in pursuing all avenues of communication possible to make sure this benefit that could benefit Connecticut residents who are eligible for it. They know about it, and we're gonna, even if we have to drag them, pull them, we're gonna do whatever we have to do to get them to apply for this benefit through Access Health.
No, I think that's great. If there's one thing I believe in, it's knocking on doors. I think part of my point, in addition to sort of getting to that number, is also I fear, the scope of that pool is well described, is maybe not as capable to get to that 40,000 number that was envisioned, and communicating clearly to the policymakers or what success looks like versus failure looks like, I think will be very important for us as an organization and for the program in particular.
Thank you.
So that last point, I think, is a very good one, and I appreciate that too. That is defining success and failure, very important thing. James, I'm sensitive to the fact that we're 15 minutes over time here, and I want to be respectful of the board's time. So I think maybe we need to think about wrapping up again, maybe invite the board members for any last questions. But again, I'm afraid of losing a quorum here. So let's.
Yeah, I appreciate that. I think we have maybe a 3-minute presentation left about the health disparities webpage, and then that'll be it.
Okay, let's do it. But thanks, Rob.
Mr. Chairman, we could do this at the next meeting as well.
Yeah, let's do that. I worry that people have we've indulged people a long time here, and again a little bit the board's work. But any last questions from the board? Let me just ask that. Otherwise, I might ask a motion to adjourn. All right. Hearing none, thank you all very much. I am especially grateful for the engagement of this board. It really is a great opportunity, and the problem with that is people keep talking, which is wonderful. Thank you so much. Could I have a motion to adjourn?
So moved.
Second.
All right. Klippel, yes.
Paul Philpott. Mr. Philpott is on. Is Mr. Philpott on? You're muted, Mr. Philpott.
Sorry, yes.
Thank you. Gregory Messner?
Yes.
Adrian Gifford? Commissioner Gifford has left. Graham Rader?
Yes.
Silva Hernandez? Peter Doolittle?
Aye.
CC Woods?
Yes.
Thomas McNeil?
It's gone.
And Matthew Brockman?
Aye.
Thank you.
Thank you all. Appreciate it once again.
Thank you.
Thanks, everyone.
Thank you.